Hi, my name is Marian Tawatsky, and today my drug research is all about the medication for HIV. Before I begin, I would like to give a little information about what is HIV, which stands for Human Immunodeficiency Virus. HIV is a virus that attacks the body's immune system. It infects and destroys cells, helper T cells, they called it, that helps the body fight infection. HIV is a transmitted disease through blood, vaginal fluid, and so. Here's the percentage about how HIV get transmitted. 10% is use of non-sterile and syringe and tools. 10% through pregnancy and breastfeeding. 5% through blood transfusion. 5% as well for organ transplant. But the most common one is 80% through unprotected sex. If we don't treat HIV, it will eventually cause AIDS in the infected person. AIDS means acquired immunodeficiency syndrome. Right away, it already got a sense that HIV attack immune system so destructively that it ends up acquiring immunodeficiency syndrome. It is a state of immune system failure. It's like ending up not being able to fight to the most basic infection. So, I have a question here. True or false? You can tell by looking at someone whether they have HIV. The answer is false. The only way to get to know if a person has HIV is to get HIV tests. My drug research is about Biktarvy. Biktarvy is an FDA approved drug. It was approved last February 7, 2018. Again, Biktarvy is an FDA-approved medicine used as a complete regimen for the treatment of HIV-1 infection in adults and pediatric patients, at least 2 years of age and weigh of 14 kg, approximately 31 pounds. Drug class is antiviral combination. I will try my best to pronounce the generic name because there are 3 antiviral medicine in one medicine. The generic name is Biktarvy, amitriptyline, and tenofovir alafenamide, which is sometimes shortened to BIC, FTC, and TAF. That's the tablet look like. Intended medical use. Biktarvy is indicated as a complete regimen for patients in several different circumstances, provided they meet specific clinical requirements, such as an absence to no resistance to its component drugs. Individuals new to HIV treatments. These patients is who have never taken HIV medication before. Patient 2, individual switching regimes. It can replace a current stable HIV regimen who have achieved an undetectable viral load. It is like the patients who want to switch to Biktarvy, but they have already able to get HIV treatment before, but with different medication. Number 3 is the reset. This is the individual restarting treatment experience and not suppressed. These patients with treatment history but not virologically suppressed. What is the treatment of this drug? Biktarvy is a complete HIV-1 treatment in once-a-day singlet tablet pills that contains 3 antiviral medicine. So, Biktarvy works by preventing HIV from multiplying, lowering HIV blood levels, and decreasing the chance of developing AIDS and HIV-related illness such as cancer or serious infection. Is the drug natural or synthetic? Biktarvy is a synthetically produced drug. It is not derived from a natural source, but is created through a series of chemical synthesis steps in a laboratory. The entire combination of drugs in Biktarvy is a product of pharmaceutical research and chemical manufacturing. What are the contradictions? Biktarvy contraindicated with the medication of dofetilide or ticozin. It can significantly increase the concentration, raising the risk of serious or life-threatening heart rhythm issue. Also, with Rafidin, this antibiotic can substantially decrease the level of Biktarvy component of Biktarvy in the blood, leading to loss of HIV treatment effectiveness. What percent of Americans use a drug in this class? As of mid-2024 to 2025, over 430,000 or 0.13% of people in the United States use Biktarvy for their treatment. What is the drug class in these scheduled drugs? Biktarvy is in a class of medication called integrase strand transfer inhibitor, and it's not on a scheduled drugs. What are the short-term effects of the body? Short-term side effects of Biktarvy most commonly include gastrointestinal issue like nausea, diarrhea, indigestion, as well as headache, dizziness, and fatigue. These side effects are often temporary and tend to decrease as your body gets used to the medication. The longer side effects of Biktarvy can include serious liver problem, new or worsening kidney issues, build-up of lactic acid in the blood, or lactic acidosis, and depression. How long does the drug stay once consumed? Biktarvy contains 3 different HIV medications, which can stay in your system for different period of times. Usually, it can take 3 to 4 days for most Biktarvy to leave the body. This time frame is estimated based on half-life of different ingredients of Biktarvy. What are the side effects of this drug? The following common side effects may get better over time as the body gets used to the medication are diarrhea, nausea, headache, less common other side effects like abnormal dreams, tiredness, bloating, sleep problem, also swollen belly, passing gas, heartburn, belly pain, and again, feeling depressed. What are the withdrawal effects, if any? The main withdrawal effects of stopping Biktarvy side effects can lead to more serious health issue like HIV viral load rebound. Allows the HIV to actively reproduce, leading to rapid increase in the amount of virus in your blood. Give a myth about drug and explain why this is incorrect. A myth about Biktarvy drug is that it cures HIV or AIDS. This is incorrect. It works by significantly reducing the amount of HIV on the body to undetectable level to viral load suppression, but it is not a cure. Interesting facts about Biktarvy is that it is a currently number 1 prescribed HIV treatment in the US and globally. According to the World Health Organization, as of 2024, 40.8 million people living with HIV globally. And UNAIDS data show year of 2022, 29.8 million of the 39 million people living with HIV globally are receiving life-saving treatment with antiretroviral therapy, including Biktarvy. Question, how does Biktarvy works in the body? Stopping the virus from multiplying, helping the lower viral load amount. What are the serious to long-term side effects of Biktarvy? The long-term side effects could be kidney problem, liver problem, lactic acidosis, mental health, and issue like depression. Here's the informational website that I use and the publication that I found on the internet and the UNAIDS report. Thank you so much.